Hey, what's going on, guys? Welcome back to my channel. So I'm one more rotation down for intern year, and today's video I want to talk all about my emergency medicine rotation that I just finished up. There were a lot of ups, there were a lot of downs. Overall, I'm definitely glad to be done, have one more rotation in the bag, one step closer to being done with intern year. But in this video, I want to go through kind of what the rotation was like. My favorite parts were, what I didn't like about the experience, some of the stuff I learned, and then some of my tips on how to do better on your emergency medicine rotation, make it a less stressful month. Stick around to the end because I want to touch on a few important things that I learned on the rotation that are really valuable to know whenever you're off service rotating through the emergency department, and then important to remember when you're on your other service about what goes on in the emergency room. So don't forget to subscribe to my channel to see the rest of these videos and be up to date, and let's talk about my emergency medicine rotation. So overall, I'd probably give this past month like a B+. Wasn't the most fun that I've had this past year, but also wasn't the most stressful. As you might know, I'm going into physical medicine and rehab next year. So in terms of like the acuity spectrum of super urgent life-saving and, you know, can walk and take your time, I think PM&R and emergency medicine are like on the exact opposite ends. So definitely was out of my comfort zone, not really where I feel like I fit in the best, but learned a lot of really cool stuff, lots of useful tips and things that I can carry with me throughout the rest of my career as a physician. And so overall, I was glad that I got to have the experience. So here at Mayo Clinic, both the categorical interns and the prelim medicine interns both do 1 month in the emergency room during our PGY 1 year. And the shifts here are kind of nice. They're only 9-hour shifts, but really it's more like an 8-hour span because there's some overlap at the beginning and end. So 9 hours that you're kind of expected to be at the hospital during your shift. And I think I worked 18 shifts throughout the month, so it's kind of right around that range in terms of the number of shifts you work. I will say though, one of the things I didn't like about this month, and it was probably my least favorite thing to be quite honest, was just the variation in the schedule. You know, I don't know how people who go into emergency medicine can do it, because I really don't like how much the schedule jumps around. You know, one day I was working like 4 p.m. until 1 a.m. and then the next day it's 2 p.m. to 11, and then I have a day off, and then I come in at 6 a.m. the following day. So I couldn't keep any of my days straight. The schedule jumped all around. Pretty much on the days I was off, all I wanted to do was sleep. So that whole schedule change was definitely something that I didn't enjoy. But if you're going into emergency medicine, you know that's part of the job and probably something that you're okay with. So not a big deal. We worked with a lot of other specialties in the emergency department, and then of course the emergency medicine residents. I think on pretty much every shift I had down there, I was with at least one, sometimes two emergency medicine residents. And then of course we always had an emergency medicine attending who was down there with us, but then lots of times there's other services who rotate through the ED with us, like the surgical services, anesthesia, psychiatry, family medicine. So pretty diverse group of folks that we work with here in the emergency department. I think the biggest thing that I learned this past month looking back that I'll carry forward with me was just how to handle acute situations. I mean, when you're on call on medicine and other services, you're always going to get those phone calls, those pages in the middle of the night where someone's, you know, feeling short of breath suddenly, or their vital signs have changed, or they're having chest pain or some other pain. And so when you're in the emergency department, you're really learning how to respond to those acute complaints and very efficiently and effectively kind of work through your differential and then come up with a plan going forward. So it was really cool to have that experience basically for the entire month, where all I'm doing is trying to think, you know, within 5 minutes or so, what's going on with this person? What do I need to do to stabilize them? And then what's really the rest of my diagnosis and workup? Looking back, like on what I actually saw, it's kind of strange. You know, I spent a month in the ED and I didn't see a single STEMI. A lot of times here, it seems like the STEMIs were called in the field and then they'd go to like the resuscitation rooms. So if we saw one, it was because we found it after they came to the ED, and that wasn't really the initial complaint. Did see a handful of in-STEMIs though, so at least got some experience with kind of what to do in ACS. Lots of just shortness of breath, colds, pneumonias, influenza, lots of abdominal pain. Saw a handful of septic patients, finger lacerations, that was fun, but really wide variety of stuff. And the approach I would always try to take was basically just look at the chief complaint and then maybe take 1 or 2 minutes max to look through the chart and go in and see the patient. So I was really trying to go into it kind of pseudo blindly just to get that experience with, all right, what's the main reason they're there? What are the pertinent questions to ask? And then how do you move forward? I've already mentioned kind of the overall schedule, how I didn't really enjoy that. But the other thing that I think is kind of hard to wrap your head around when you're in the ED is, you know, nowadays with medicine, we have all these tests that we can do. We have all these labs we can order. A lot of times patients would come into a room and they would have already gotten like an abdominal pain panel ordered in the waiting room because they had abdominal pain and looked sick. And that's all well and great because it makes things move quicker and we're taking advantage of technology. But I feel like at times you almost didn't really have as much like, let's think through the symptoms, let's think what this really is and see what we want to do. Because if you had any concerns, you basically just do it. I mean, we have access to all this great diagnostic testing that if you're really concerned about something, just get the test. There's no sense in waiting around to then order the second test or the third test after everything else comes back negative. And so you almost have to just kind of internally think through what you would do and what the best steps are to work something up. But when you're in the ED and you really don't know what's going on initially, sometimes it is best to just get a bunch of different tests, kind of put out a much wider net, and then kind of tailor things in and narrow things down after they come back. Overall, probably the right approach to take, just something you kind of have to adapt to and get used to if you're not primarily going into emergency medicine and working in the ED. The biggest tips I can give for how to make your emergency medicine rotation easier, whether you're in medical school or in residency, kind of silly, but number one, like pack snacks. You won't necessarily get like a lunch break or a dinner break where you can just go leave the emergency department for an hour and like sit and have a meal. So like bring some protein bars, bring like something to drink, some energy drinks if you need it, some snacks. Bring something with you because if you're really hungry and you're really stressed, it's going to make your shift worse. But if you have something to eat there handy, it's going to make things much more tolerable. As simple as that. The other thing is have some sort of good quick reference that you have open on your computer so that you can look things up quickly if you need to. In particular, there's one iPhone and Android app that I use that was really, really awesome. It's called QuickEM. And basically this is an app that's a free version. There's also a paid portion to it with some more information. But you can go through and it's got a whole list of chief complaints and you can select them. It tells you kind of what the most life-threatening things are, what your differential should include, what tests, workup, etc. Really great resource if you know you're just completely confused about what to do with this red eye that comes in that you've never seen before. Gives you some great tips and kind of a guide to step through how you would work that up. Have some sort of effective note-keeping strategy. I think a lot of the folks I worked with had just like a cheap little, 5x8 notebook that they would carry, and kind of each patient was a different sheet of paper. Obviously the upper level EM residents would have a much smaller piece of paper and jot down less notes, but for me, I just had my little notebook that fit in my scrubs pocket. I could have one sheet for each patient, and then at the end of my shift, I could just rip them all out, throw them in the recycling, and not have to worry about having all these loose sheets of paper laying around. And now last of all, maybe the most valuable lesson outside of the medical stuff I learned in the emergency department last month, you don't really know what a field or a department's like until you rotate through it. Up until now, I've had to get sign out from the emergency department on patients coming to our service. And I'd get super grumpy, they'd page you like, oh, please call back within 5 minutes. And then right on 5 minutes, they'd page you again, please call back. And you'd call down there and then the person would have to take a minute or two to kind of go gather their thought. And before doing this rotation, that would just annoy the heck out of me because I'm thinking like, how do you not know all this stuff? You're their doctor. But then after you rotate down through there, you realize really quickly that like you don't have time to ask them about all of their travel history and go through all of their extensive family genetic history. Usually when you get paged that you need to call for sign out, you're in a room like taking care of someone, and so you have to politely interrupt and leave the room and go to your computer and then go back to the patient because you might not have actually done anything for him for an hour because of how long sign out has taken. If you're on other services, if you have or even if you haven't rotated through the emergency department, be patient. Like understand that you don't really know what that world is like and you don't live in that world, and so it's not really fair to pass judgment about what they're doing, what they're not doing, how quickly they went, how slowly they went on things, because you're on a totally different side of the fence. So be understanding with the emergency department whenever they call you about a patient. Understand that it's the emergency department. They're not down there to do the complete workup and figure out all the little components of the history. Their job is to stabilize people, intervene if they need to save their life, and then move them through, because as they always say in the emergency department, the sickest patient is the patient that's in the waiting room that you haven't seen yet. So that's it for this video, guys. Like I said, pretty excited. 1 month closer to the end of intern year and on to PM&R residency. It's awesome. I only have, I think, 3 more months of stuff on the wards, and then we're done. So I hope you enjoyed the video, guys. Good luck on your emergency medicine rotations, whether you're in medical school or still have to go through them in residency. Let me know if you have any other tips for success or things to do differently while you're in the ED. Thumbs if you like this, subscribe if you want to see more videos, and I'll talk to you next time. Thanks, guys.